Welcome to the HEKIMA Podcast, where we talk about mental health research into the layman's understanding or what the public should know. We try to dissect things that we meet in our field of mental health so that you, who is watching, the viewer, can make sense of these concepts. And I know concepts is also another word that maybe I need to break down. We want to thank our funders who make this possible so that you, the viewer, can get tuned in. APHRC and Wellcome Trust make this possible. Today we are going to delve into matters that include stories. You've probably told a story. You've had a story. And this story, in most cases, when we talk about mental health research, is usually converted into data. And between hearing or collecting the story to making it data, they are what we call ethics. In a normal sense, you would call them morals, or the rules that are supposed to be followed. And with me are some of the experts that are very good with bringing light into what are these rules, what are these morals that should be followed or should be put in place or should be upheld while we are collecting people's stories into data. And I would like to bring your attention to these experts. With me is, of course, Wilber. Wilber, would you like to introduce yourself to the viewers?
Thank you, Raymond. Happy to be back again. My name is Wilber Ssembajjwe. I am a biostatistician by profession. I work with the Medical Research Council, Uganda Virus Research Institute, and London School of Hygiene and Tropical Medicine. On the Mental Health Data Prize, I'm the co-lead on the Digitizing Psychosis Care Project. Happy to be back. Thank you.
Thank you, Wilber. I actually remembered that while you were introducing myself, I had failed to introduce myself to the viewers. Raymond Mugume, a psychiatrist, a runner, a Rotarian, is always your host here. And after Wilber has introduced himself, would like to talk to the lady. Today it's not Rita, but we have a new lady. Please welcome Sylvia to the show.
Yes. So thank you so much, Raymond. My name is Sylvia Navkenya. I am a bioethicist. I like to talk about ethics, the rules, the morals. But I work with Makerere AI Research Labs in Makerere, and that is under the College of Computing and Information Sciences. I am so excited to be here.
Thank you. You're welcome to HEKIMA Podcast.
Thank you.
Thank you.
To begin with, do you feel safe with your phones?
Yes and no.
Okay.
Yes, to the fact that it helps me do my routine work and keep my day-to-day activities up to date. But no, because I think because of the recent technologies, there is so many things that we use our phones for that we may not be sure who is looking at them or who is in the background looking at which data we are collecting.
Yes.
Or which performance on my phone. So some of those things you are not sure of where the end product is, despite the agreements that you sign, because for every platform you go to, there is some agreement. I don't know if any of you has ever read those agreements.
Not
or
me.
you just check
Not
them.
me. I really check.
When it is the product.
Yeah.
Yeah.
So many of those things we don't take really keen, not all.
Yeah.
And I think it gets me worried a bit.
Okay.
So am I safe with my phone? I'm not sure.
You're not sure. If I asked myself the same question, I would like to think that sometimes I feel safe, sometimes I don't. Especially when you download apps and then they ask log in with your email or with your. So I'm not sure if which email I should give them.
Should we link to your email?
Yeah.
Should we link to your
Everything.
LinkedIn.
Yeah.
So I don't know which
socials.
one I should. I
Yeah.
should or socials or Instagram. So
Yeah.
because I keep thinking that someday maybe I might end up taking up office, and then usually they have to go through your
And
socials.
your history can't
Yes,
be relatable.
Yes.
Yes.
True.
Eh,
Yeah.
What about you, Sylvia?
So the question of whether I feel safe with my phone, when I used to lie to myself that as long as I have my passwords in, No one can get into the phone and check it out. Until recently, I learned that when a thief snatches your phone, somehow they actually get to the password.
They do.
So don't be surprised that this information or your information is private. So that really concerns me. But I like my phone. It does so many things for me. The only problem is that it's also a data collection tool. It captures as much information about me as possible. And for some reason, I think my phone has a speaker that someone tracks on. Why I say this is that oftentimes we are talking about this particular information, but later on my phone, I will see publications coming through about ethics, data science.
okay.
And I'm like, now, who was part of this when they're in my phone? So I don't know if you guys have experienced that. You talk about things casually with other people, and then you later find Google sending you particular information about
the same
what
thing.
you've just been talking about.
I think it also happens with the new AI platforms.
Yeah.
Many times when you sign up, you're a new user of the platform. But the moment you link it with your Google,
Google.
Yes.
it knows everything about
you.
Yeah, and so I guess then it opens the conversation,
Yeah.
right? Sylvia just talked about ethics.
Yes.
Do you want to help us understand what is ethics?
Okay. Yes, good question. So, our lay understanding of what ethics is about doing right and what is wrong, differentiating the two. When we talk about something like the morals that help us do right things, as we think about ourselves as human beings, we are responsible for doing right, and we're responsible to let go of things that are bad. And what do I mean by doing right? We do as our actions and our intentions to act, for example, researchers and healthcare providers,
Yes.
it is important to have at the back of our minds what we intend to do and what we are actually doing respects human dignity, respects human rights. It is avoiding or minimizing harm as much as possible. And then it's actually promoting well-being, general happiness. You get, we should be happy and live in harmony with one another. And that is why initially you talked about the rules that ethics, emphasize that people should follow. These rules are there to help us live with one another in a harmonious way. And when we talk about the harm, doing right is doing good. Now, harm comes about when you're doing wrong. We tend to harm one another in different ways. It could be physical, a punch. Clinical trial could actually inject someone and they react, lose their limb or anything comes about.
Okay.
But then there's also social harm, psychological harm that sometimes we do not put into consideration early enough.
Yeah.
When we are collecting data?
Yes, when we are collecting data. Imagine the time when, for example, you get to a refugee camp
Yes.
where people are actually trying to recover from
The
losing
migration.
the migration,
The wars.
the wars, thank you. All those nitty-gritty information that I've tried to recover. And then you have to ask them questions that are kind of provoking the memories that they had while they're still on the recovery, space.
Journey, yes.
And they haven't yet really made themselves strong enough to stand certain questions.
And
so
also-
bringing back those memories actually going to be very harmful. They will break down, get depressed again. And, so social harm is actually real.
Okay.
Yeah.
So I think what I hear from your conversation is that ethics is doing right
Yeah.
and avoiding doing wrong.
Exactly.
All the
And
time.
simple. Yeah.
And so that brings me to so Wilber was saying that he's clocking 10 years soon to in his role as a statistician.
Yeah.
I wonder in your 9 years, right? Why does it matter to have ethics?
So at the end of this, remember, this podcast is about mental health for the public. And the public is usually the people we do conduct the research on, the participants. So the ethics is supposed to protect those people. Many times, I think like I've said on previous podcasts, is that many times a researcher will come, I want to answer their research question, I collect their data and move on. But sometimes it's at the expense of
the public?
of the public,
Yes.
of the participants.
Yeah.
And like she talked about clinical trials, you may be trying a new treatment or a new therapy, but that treatment could be could have adverse effects on probably the people going to receive it. And because you don't know, you're just trying it out.
Yeah.
If you don't follow those strict criteria that should be followed in the ethics, you're going to harm the participants.
Exactly.
Thank you. And I like the conversation it's heading. So one is that I think we need also to demystify that in mental health research, we also test drugs.
Yeah.
But the main part that we usually interface with is that we get people's stories.
Yeah.
And like Sylvia said, depending if we follow the rules or the morals, or if we don't, we cause more harm than good in trying to to listen to the stories of our patients.
Yeah.
So the stories could include, I'm feeling angry, I've not been sleeping, I'm not able to eat, I feel I've lost morale. So that is part of the story. And so we need to have to follow the rules in doing right, in listening right, okay?
Right.
But also, just to understand, when I asked you about the phone, you did talk about that the phone collects data.
Yeah.
Yeah.
Would you like to tell us maybe some of the tools that we have used over the years to collect, they could be to collect people's stories?
Yeah.
What are some of those tools that
So-
you have come across?
Over time, the research environment is growing and improving, and a number of things are changing. Almost every 2 or 3 years, even during the year, you can see many things changing in the research environment.
Yes.
9 years ago, most of our projects were collecting data on paper.
Yep.
So you write out your questionnaire, you print
Yeah.
it out, and then you send it out to the field or give it to field workers. They send it out to the field, they collect the data, and then bring it back. You do the manual data entry, sometimes double. So that entire
You
process,
double check
you
if
double
it is
there's a
correct.
quality thing, blah blah blah. So that entire process would take a long time. So with advancing technologies, there is a number of tools that have been put out. You could have heard of RedCap, Combo Collect, ODK, Savacity, or there are a number of them.
Okay.
Even now, Google has its own tool that on the browser that you can use to collect survey information. So there are a number of those tools that have come up, and majority of these technologies to help improve systems. So time is saved, resources are saved.
Yeah.
Because instead of hiring maybe 10 research assistants to go out to the field and collect paper form questionnaires, you could sit in your office, send out this link
Yeah.
On email or
email
social
or
media, on
social media,
WhatsApp.
and people respond, and you get real-time information. You get real-time feedback about your questionnaire. But I think, like, as we go on into the discussion, also the electronic data capture tools have their own ethical guidelines that should be followed. Yeah, so I think that summarizes the number of the tools that we have. The commonly used in Uganda, I think, is Savacity or RedCap
And Kobo.
And Kobo.
Yeah. So you did talk about why they have replaced the paper to save time, to
Also the environment.
Reach,
to help
yeah.
inform policy to
Reach far.
and reach
People.
far. Yeah. Meet your target maybe population.
Yeah.
And so the other question that I would have is, what ethics then do we look at when we are collecting the data in that form?
In that form. Perfect. That's interesting question. And you see, like Wilber has mentioned, as technologies advance, we also need to advance. But as we advance, we need to keep ethics at the forefront. And as I mentioned earlier, it is important to take note of the glimpse of the harms that could come through while we're getting excited about technologies saving our lives. So one of the key things that I would like or appreciate about these tools, one of the, like, for example, when you send out the link and then someone uses Kobo to respond to this particular information, it kind of takes away the social desirability issues of, I want to tell you what you want to hear. You're not going to ask me how many sexual partners I have, and I tell you truthfully. So if I have it on my space, it's confidential information, I can speak. I can be open to it and tell you the truth.
Okay.
So that's one of the good things. But when we look at the key things that ethics have to follow when we're using these tools is, one, when we're doing research, collecting this data, one of the key points is informed consent. And informed consent respects participants' autonomy. in a way that the decisions they make to participate in your work, in your study, is dependent on the information you provide to them during the informed consent process.
Okay.
The question here is, how adequate is the consent that is obtained through these tools?
Yeah.
For example, when we look at REDCap, before REDCap came in, it was a face-to-face. You sit down, you the researcher, tell me about it, discuss the purpose, the risks, the benefits, how you're going to mitigate the risks, especially issues around my data leaking, and what measures you have in place. You tell me all that, and I give you questions. I ask you back, what if this and this? What if I've not understood this? And you explain to me better to understand what you really want. Now, when it gets to these online tools, who do I have before me to ask my further questions about the study?
Yeah.
And how do we get to a point of making sure it's not being very coercive, so that the fact that I still have some questions, but there's no one to ask. So I have to just go ahead and feel and provide as much information as possible, you see. And you see, the other key thing is, when I have questions about how safe my data is, that the consent form that could be sent to me electronically, I have read what you have only provided there. And so I'm left hanging. What is the data handling procedures here? What laws are there for me to be sure that my data is going to be safe?
Yeah.
And who actually is going to look into this data besides the researcher who approached me via email, via telephone call? Who exactly is going to, look into my data? And do I feel happy that this person will not easily or freely share it out there? And will they keep will they keep the part of their bargain, what they promised to do? Is that what they're going to do? Exactly. So that's some kind of ethical issues that we need to put into.
So Sylvia, as you give that detailed explanation of the challenges, I kept on thinking, just as a breaker, would you regard yourselves as good cooks?
It depends on what I'm cooking.
I think I enjoy being in the kitchen. So
really,
and I can do a number of things in the kitchen. I can do lots of magic in the kitchen.
Now, I'm sure if I was a viewer, I would like to know what you're good at cooking.
I took a lot of time when we were locked up to learn a number of dishes, local and continental.
It had to be COVID.
It had to be COVID.
To teach you.
So I learned a number of things: baking, the confectionery, and a number of other things. So with the kitchen, I'm sorted.
Yeah.
So would you say you're a good cook?
I can't say I am a good cook. It would be the person eating my food to say this guy is a good cook.
How about you, Sylvia?
For me, it would depend on what I'm cooking. There's certain dishes that I don't enjoy, and there are other dishes I enjoy cooking. Like meats, I'll be very good with. The stews, the baking, the steaming, the what? Grilling. I would like to do that.
Okay.
Yeah.
Why ask you that question?
Yeah.
That's how stories begin, right?
Oh, yeah.
That's how stories begin, and that's how we collect data.
Yes.
So when we talk about data, and again, on this podcast, we are trying to relate with the public on, when we talk about data, they are not the big things. It is just as good as just asking you that, okay?
Yeah.
But just that what we are delving into today is that we are collecting it electronically. Like there's no person who would ask you that.
Yeah.
It is sending you a link on your phone and filling it.
Yeah.
What would prompt you to fill the form?
Yeah.
Is it that if you fill in the form you'll be reimbursed with 20,000? Or is it that you know Wilber on a personal level, you know the research on a personal level? Or is it that maybe this kind of subject has always fascinated you, so you want to participate? What do you think usually, when you think about it, when people participate, following the rules again? Because like you said, people have the question, but there is always that one reason why someone decided to fill in the form.
Yes.
So I think it's a number of things. As researchers, sometimes we're also participants. And even me as a participant would like or would love to be respected. So I wouldn't want to be coerced into answering questionnaires that I'm not interested in. So a number of things would move me to answer your questionnaire.
Okay.
One, am I interested in the topic, or do I have information about that topic? You might ask me about things that I have no idea about. I'll probably tell you I'm not comfortable answering that because I don't know.
Okay.
So do I have the information? Am I comfortable in giving that information? Do I feel secure that the information I'm giving you is safe? So if I check all those boxes, I'll happily respond.
You happily pay.
Much of it is not really about the reimbursement.
But most it is.
Sometimes.
I think sometimes it is. Imagine, like giving an example of you've gone to a refugee camp.
Yeah.
People, they haven't settled in, but they have come in, right? And you're the aggressive researcher, you need data. And again, maybe you're targeting your grant. Yeah? You're targeting a publication. You're targeting a conference, right? You go in. In going in, you go with a reimbursement of 20,000 Ugandan shillings. But you've met a refugee who has nothing. So tell me that in all honesty, with all the ethics, that will not feel like a coercion for the participant.
Of course, it would motivate them. And the truth is, majority of the communities we go to are really impoverished. So you'll find that some even try to come back in. Maybe someone came before without glasses, they would come back wearing glasses and a cape to try and have an interview again because they want that second reimbursement, or come back in some sort of different form to come and get that reimbursement. So you can't rule out the reimbursement as a reason for why people participate.
So that brings me to the challenges, Sylvia. What are some of the challenges that come with collecting data in a digital form, since paper is no longer considered at this point?
Yes, wonderful question. So some of the challenges here we have is, one, like I'd earlier mentioned, something around inadequate consent. People not clearly understanding what these tools are about. But then one other thing that I really emphasize here is to avoid the challenges in communities. It is very easy for someone to wonder and question, what exactly are they collecting with that tablet in front of me? When we had paper, it's paper. Everyone is seeing it's paper. But now you have a tablet and you're in the field collecting data on your red cap. I know there is a particular study actually where we're doing this in the field. Some participants raised concerns of, isn't my voice being recorded? Why do they have a tablet before me? So the key thing here is how well can we be transparent and first of all explain what the tablet is capturing, what is exactly we need from you, and how much data are we going to collect from you as an individual. That has to be very clear before we cause challenges in relation to people speculating, aren't they recording my voice? Aren't they, picking things that I don't know of? Someone actually saw a tablet in the field and they're like, probably they're taking pictures when someone just raised it to do some saving and then move to the next participant. So what these challenges, we can't really run away from them, but then also assuring the participants before you that this tool is actually doing only this and not doing what you anticipate that it could be doing, because it could be more of a misconception. Yes. But then also the other thing is emphasizing that the data and the information you're collecting, what is it going to be used for? And how are you going to protect it? How are you going to save it? We've also had some times when we interview researchers, educated learned people, and they'll give you questions of, but where is the server located? Why do we need to share this particular information?
Who has access to
and
that
who
server?
have access to it?
Yes.
And when you're putting it out there in the cloud, who exactly is going to have, who will put some controls to make sure that not everyone will access this data, this information? So there's so many questions that we have to say, okay, now the server is actually in our institution, it is best here, and no one will have access to it. This is information that you need to provide to the potential participants early enough and explain it in detail so that you gain their trust before the challenges become trouble for you to collect your data and finish your study.
Thank you, Sylvia. So, and again, we need to remind our viewers that this is the HEKIMA Podcast. It has been made possible by APHRC
Yes.
and welcome trust.
Yeah.
Okay.
Together with other partners, there's Butabika National Referral Hospital, there's the Uganda Society of Health Scientists,
Okay.
there's the Department of Psychiatry at Makerere University,
Yeah.
and without forgetting, of course, our PI, Dr. Mwesiga Emmanuel, who sat down and thought that, you know what, we need to bring the public aware of what is really happening.
Yeah.
Just to get to the next part of this story is that collecting data or collecting people's stories in a digital form presents the challenges that you've mentioned. And you've said informed consent is not a one-time thing. It has to be a continuous process
Yeah.
so that the participant should understand, right?
Yeah.
So when you found people who have varying literacy levels, who have different levels of education, right? Are there any challenges that you would want to bring the public aware on what those challenges look like, and if they should be worried about those challenges because of their education levels, or should they still go ahead and just listen to the researcher or to the research assistant, and still participate in the mental health research?
Yeah.
So before Sylvia goes, I think she's ready to
I
hit.
know.
So one key thing I need to tell the public is that much as you give your consent, at any one point in this research, you can withdraw it,
Yeah.
and you will not be held against your decision.
You're sure they won't be refused from getting medical help, or
And
it
any other
shouldn't
be
system.
supported.
It shouldn't be.
Support,
So you
yeah.
should be able to withdraw if you feel uncomfortable about any of the procedures. You can withdraw, and you don't have to consent to everything. You might consent to the interview, but not consent to maybe a blood sample collection.
Yeah.
Yes.
So the public needs to know that at any one point in the research process, you can withdraw all your consent or some bits of it. But then you talked about the challenges
of interviewing, or of collecting stories from people of different education levels.
Yeah.
Yeah. And I think majority of the communities we interface where we collect most of this data are rural and not very exposed communities. So sometimes you find challenges of you have to translate these tools or instruments to many of the languages you're going to conduct in these areas where you're going to conduct the research. But also you have to sit down and explain to this person or this participant every single bit. And science is a bit complicated, so bringing it down to a layperson and telling them that your data is going to be safe, it's going to be secured on this server. Now explaining a server to a participant is going to be a problem. Maybe tell them it's going to be to a cloud or whatever. So explaining all those details might be a challenge.
It is a challenge.
To the researcher, but also for the person being
Who is on the receiving end.
Yes.
And so, are there any strategies then we can use to, the ones that you have used, the ones that you have advised, the ones that you know about, I guess for me and Wilber, since we are into mental health research, just to know what are some of these strategies that have been found effective?
So one of them, I could have like three of them, but one of them, the first one, is training research assistants very well. Teach research assistants patience. Patience is a key word in that if a participant has not understood a given aspect in the whole informed consent, be patient enough to explain over and over again.
Before you start collecting
Before you start
data.
collecting the data. And what it makes it very, very, a little practical is have some form of formal and informal assessments.
Yeah.
Ask questions of, we have said we need you back after 2 weeks. What did we say we will do every after 2 weeks we called you back?
Yeah.
Find out, gauge, see, have they really understood this? Have they understood the procedures?
I think it's what they formally call assessment of understanding.
Yes.
Assessment of understanding.
And
To the
then
participants.
to the
To the
participants,
yes.
yes. But then also this assessment, make it in a way that it is not judging someone. You're not attaching a score to it. You're not saying if you don't score 80%, you're not literate. Like you just can't understand. No. make it in a way that it's informal, casual discussion, so that they feel happy
Yeah, so
about
if they're
it.
sitting on the mat, sit on the
Yes,
mat.
sit on the mat. Relax. Use local language. Use the language that the patients or participants understand as much as possible,
Okay.
so that they can easily understand and be on the same page.
Yeah.
But then also using simple words and local languages is also another strategy.
Yeah.
Speak to them in the language that they understand and they're comfortable with, to be expressive.
Yeah.
You know, when you're collecting data, you don't collect data just paper ticking. Even non-verbal communication is already showing you what I'm telling you.
So
Yeah.
I know that's very interesting.
Yeah.
I think that brings in a context of culture, right?
Yes.
So if you've gone to the Baganda and you find that the research assistant is a lady,
Yes,
right? But then
yes,
she
yes.
has to interview the gentleman, an elderly.
Yes.
Should they kneel down?
That could be part of it.
If
That
it
could
makes
be
them
part of
comfortable.
it. If it makes
that's
them
what will make
comfortable, right?
You can leave them to sit on their chair as you sit down
On the
floor,
mat.
on the mat.
Mm.
Yes, it's good to blend in
You
society.
we must learn to blend in
Yes, let's
with our
blend in.
people.
Exactly.
I think what we also need to know is that these are interviews, they're not interrogations.
Yes.
So if you, also the researcher, if you approach this like an interrogation, the participant will be bored and they'll
And laid
basically
back.
turn
Well,
off.
they'll block you
Yeah.
off.
They'll
Yeah,
block
they'll
you off
block
and
you.
probably just give you answers to finish the
Exactly.
session. But if you make it conversational and
Yes.
engage each other, then to make it easier also for the researcher.
So
Yeah.
as we think about this more, how do we then balance the need for robust data sets, right? You want the right data
Yeah.
vis-a-vis individual privacy. How do we strike the balance when you think about it in these morals, in these
Yeah.
rules that have been put
Yeah.
forth by the researchers before us?
Yeah, so one of the keywords that we look out for when we are doing this data collection is something called data minimization. Data minimization is all about collect only what is relevant for that research question at that point in time.
Yeah.
Don't collect data that is out of, the scope of your work,
Yeah.
because we are actually now, that can bring you to an opportunity to misuse that data, because it's initially not what you meant to use, but just because you wanted to collect as much information as you need.
Why I'm laughing?
You're basically
yeah.
taking advantage of the participant.
Yes.
Why I'm laughing, Wilber and Sylvia, is that so as a psychiatrist,
Okay.
when I see patients, I'm supposed to ask how they're feeling,
Yes.
what they ate. Now, however, the history usually goes well above that. We start asking about when were you born? Did you cry immediately?
Yeah.
When was the last time you had a partner?
Yes.
And
Yeah.
the look that you get
Yes.
is usually not fine. It's not
Yeah.
a friendly look of like,
I think the
You're
patient
getting
why
into
are you asking these
sensitive
questions?
questions.
Like for me, I came with the fact that
Uh-huh.
I'm not sleeping well. So why are you
Yes.
asking me
about my birth.
about my birth, where I grew up from? Okay.
Exactly, yes.
Now, when again, it's mental health research data. I'm trying to get part of your story. I think I need to clarify that why we ask, and from what Sylvia said, data minimization is that information for us. We want to look at you as a holistic, person, right?
person, yes.
We want to know that if we come up with a plan, a treatment plan,
Yeah.
it does not only
covers
focus on your how you're feeling inside. It also focuses on if you maybe have a
Everything around you.
headache, or if you have a broken limb, a broken fracture.
Yeah.
And that way, it means that by the time you leave my
Yeah.
room,
Yeah.
you feel satisfied that actually you came for the right reason.
Yes.
Okay, and so that
Yeah.
goes to data minimization.
Yeah.
That we collect the data, and again, I think we only ask the questions that we need
Yes,
really
we
to
need
ask.
to really
yeah?
ask, yeah.
Sorry,
go on.
but also if you've gone through the steps of a good research process, the research ethics committee or team should able to highlight that your questions are focused.
Yeah.
on
on
the
the
research
On the
question.
research
yes.
question. And that actually makes it different between clinical care and research.
Yeah.
For clinical care, it is good to go as far as, the social aspects of an individual. But for research, it is important that it is focused to the research question. Yes.
Okay, so that brings us to, so you have collected the data, you've followed the rules. It's about time to, but you see it's Digitizing, right?
Yes, Victor.
The one who gave you your story needs to know what came out of that story,
Exactly.
what we call results of
Yes.
your research.
Dissemination.
Yes.
Yes, but you remember at the beginning, you sent out a survey. How then do you, again, keeping in mind the rules and the morals, how do you share that information with the persons?
Yeah.
So sharing results is not as bad as sharing data. Sharing results is open. You can call the communities, you can call different stakeholders, and you tell them that maybe 2 years ago, 1 year ago, I asked this question or these questions. You gave me your responses, and we've looked at the data, and this is what has come out. If it's going to inform policy, perfect.
Yeah.
So sharing the results should be very good for the researcher. It should be good practice for a researcher because you went to these communities and asked for their opinions about something. So it should be upon you to go back to those communities and tell them now, this is what we found. If you need to change this, if you need to improve this, because this research is not helping you, the researcher alone. It should be helping the communities more. But selfish, as many times we might be, sometimes after answering our questions, we publish and archive.
Why I ask that question? Yes, Sylvia, go first respond.
So yes, so sharing results is another way of showing accountability.
Yeah.
To the
people,
public.
to the public, because you collected this information from them. And remember, every research should at least carry benefits. And you're trying to present to them, it can be benefits in form of information to tell them our practices have been this and this and that, but I think we need to revise them based on the possible harm
You ask
that we
for
could
permission.
have. Yes, and you ask for permission already.
Yeah, so do you ask for permission again from the participants that you want to present the results?
Now, that is very dependent. So in genomics and genetics research, it is important to ask participants whether they want to know this information, because genetics research also carries different risks involved when you're communicating to them.
You have brought in genetic.
Yes. So now it depends on no. So
how
what I'm
do you
trying
break
to
it
say-
down for
genetics? When
what
you're
is
studying-
genetics?
Genetics is more of when you're studying someone's genes,
Makeup.
someone's genetic makeup, their hereditary.
Oh, how they were born,
how
maybe,
they were
or where
born.
they come from.
Yes, where they come from. So
Yeah.
what your genes can do. And so that's another
genes
also
we put
together.
on?
No, okay, genes that are in our bodies that are responsible for all the different mechanisms and activities we do in life.
Or how
the
we look
decisions
like.
make, even how we look like.
How we walk,
Exactly.
how we talk, how we
And
smile.
and yes, our physical appearance, when we are black and white and mother things.
But also, many times when we're sharing results, we're sharing aggregated data.
Yeah.
It's not individual data that, hey, I went to
Yes.
Raymond and I found that he's way shorter than the general public.
But I'm told you.
I'm just giving an example. So we're sharing aggregated data that when we came to this community, we assessed for this condition and we found that maybe 30% or 20% of people in this community are having this condition.
Yes.
And what is the remedy to prevent it?
Yeah.
So it's usually aggregated, not individual.
Individual.
Okay.
I think that's the safe way to share.
Yeah.
That's
And
a
also the
separate-
impact matters.
Yeah.
So what happens if the sensitive data, right, about the patient is leaked?
Yep.
Either it was hacked or it was shared, you share on the wrong platform.
Oh, yeah, and it
or
happens.
you sent the wrong email.
Yes.
What happens
So
ethically?
ethically, there's so many things that can go wrong. For example, if information, that sensitive information leaks, there are possibilities of stigmatizing the person who owns that information. And then one key thing is that this individual as a person may not be the only one affected by the stigma. The stigma can go as far as their families, where they come from, their clans, as well as the whole community. So stigma and discrimination can prevent people from enjoying their human rights.
But also
Because-
it can prevent us getting the mental health research data, right? Wilber?
Yes. And actually, so the other thing, even people in communities may want to stay away from researchers because they know once you collect this information and you don't keep it safe, it is highly going to bring harm to us, so that people, that makes people fail
it
to want
deters
to
them,
be,
yes.
it deters them from coming to
participating
in
ever
research.
again, yes.
So along the way, so the researchers, we fail, we get a loss because we need the people to be on board so that we can conduct our research.
As HEKIMA Podcast, that's why we are trying to say that please participate in mental health research.
But also,
Because
I think
data is safe
there
with
are
us.
some legal implications that come
Yeah.
with breaching. There's ethical guidelines.
Who gets responsibly held?
So
Yes.
Is it the researcher? Is it the research assistant?
There are different levels at which rights are given, mainly in handling patient data. So we as researchers need to be careful and be sure that all the data we've been given is safe in our hands, and whoever is responsible for whatever breach is held accountable for it.
And just to add on to that briefly, all the data we have removed any patient or personal identifying information. Things around name, telephone numbers, location. You know, at least recently I learned that even the schools you went to can be used as identifying information.
Yeah.
So we need to be very careful to make sure that we remove those identifiers. Yeah.
Okay. I think as we wind down, right, what we need to make, to summarize is that we need your data.
Yes.
We need to hear your story.
Yeah.
Right? You who is living with the experience, you has suffered mental illness, we need your data, right? Because again, we are talking about mental health research data. But two, we want to give you assurance that there are rules that we follow every day, right?
Yep.
Whether you are aware or not, there are rules that we follow. We are only asking you that take interest. When you see that survey, there's always, if you have more questions, send to this email or call this number.
Yes.
And also as researchers, there are bodies that we report to ethically. So
Yes, there are also bodies that supervise the researcher or that person who has come in with the survey, okay? And they're always cross-checking us without warning. Yeah? So that's one assurance.
And there are also strict training sessions that all researchers must undertake before they actually get into the field to collect the data. So be rest assured that the data is safe, because even the researchers are trained on these rules. They are aware of them.
Yes. And always know that you have the right to withdraw.
Yeah.
You have the right to step back from that conversation of I want data at any point.
At any point,
And it should not affect whether you're going to get care, whether you're going to be treated, whether you're going to be signposted to the next stage. It should not affect that. Should it happen, please, again, those numbers and that email, call them, okay? And three is that these stories will help us to make sense of what is within our context. Again, remember that mental health research is we are comparing results from what we have here in Uganda and what has been carried out in other countries, okay?
Yeah.
Because that's where the conversation began from, okay? And so in that moment, I want to ask Wilber and Sylvia, if there was any one ethical rule ethical rule that you would want the public to have in mind or the viewers to keep in mind, what would it be?
Well, One. As a human being, I'm morally responsible for my information and my data. How I actually let it out to any other person, I am the first person, but any second person, it is also my responsibility. What I keep at the back of my mind, how safe, but then how, what do I really need this information to be out there? If it's going to be for research purposes, I am happy for that. But then if it's going on social media, always have that at the back of your mind. You're morally responsible for your information. Once it leaves you, it's no longer yours. So know where you put your information.
Yes. Thank you very much.
I think as the communities, as the public, you have the right to know every single bit of what is asked of you, what is asked about you, what is taken from you, your samples. You have the right to ask and be sure that the researcher is answering all your questions. Otherwise, you feel free to pull out.
Yeah.
I think for me to the viewers would be that informed consent is a process.
Yeah.
Yep.
Keep that in mind, that how you give out the information, when you give it out, to whom you give it to, is a process. And so it should never be, you should always question if someone has taken, today asked you, hey, today how are you? Tomorrow, if in the next 10 minutes they again ask you, how are you?
Yeah.
You need to ask them, why are you asking me, how are you? Because you already asked me, how are you, right?
Yeah.
So you should question, we should question all the time and know that informed consent is a continuous process.
Yeah.
What would be your parting shots?
Now, I'll just encourage the public to know that their data is safe. They should trust the researcher because the researcher has been trained to conduct these activities. So they should be rest assured that their data is safe. But also there are governing bodies that are looking out for whatever issue is not right with this researcher, and they are answerable to it.
Okay. The bioethicist.
Yeah.
Yeah.
Sylvia.
So what I would say is research is good. We need this data as much as possible. And what is catching here is your data is safe. People, your data is safe.
Sylvia.
Please save us and let's be good research participants and let's give us the data. It is safe. There is so many measures put in place that we have, and this data will not be leaked, will not be misused, and it will be anonymized in a way that no one will identify that it is you. Yeah. So don't worry. Whether you are a politician, you are a leader, you are a CEO, you have any mental health issues, feel free. Please reach out and give us your data so that we collectively get a solution to these mental health illnesses.
Thank you, Sylvia. Thank you, Wilber.
You're welcome.
If you've filled out a mental health survey and ever doubted if your data was safe, if you should have given out the data, or if it is stored safe, this podcast is for you.
Yeah.
Take some time and listen to it.
Yep.
We want to thank you, our listeners and viewers. We also want to thank our funders, APHRC and Wellcome Trust, for making this possible. But also we want to thank our partners, Butabika National Referral Hospital. We want to thank the Uganda Society of Health Scientists, the Department of Psychiatry at Makerere University, for being very supportive and coming on board on this project. As your guest, as your host, it's been a pleasure to bring this to you, and until next time, keep safe and keep warm.
Bye-bye.
Bye-bye. Thank you.